The outcome measure that we'll be performing today is the Dynamic Gait Index, or DGI. The ICF domain that it tests is activity. The purpose of the outcome measure is to assess the individual's ability to modify balance while walking in the presence of external demands, and it was designed to test 8 different facets of gait. The type of assessment that it is a performance. The time to administer is 10 to 15 minutes maximum. The equipment that you'll need is a shoebox, 2 obstacles that must be the same size, a stairway, and a 20-foot pathway. This outcome measure was designed to assess the likelihood of falling in older adults, and the diagnoses that it has been proven valid and reliable for are brain injuries, geriatrics, multiple sclerosis, Parkinson's disease, stroke, and vestibular disorders. The first task is gait on a level surface. I've measured out a 20 feet pathway, and I'm going to give my patient the instructions. Walk at your normal speed from here to the next mark, whenever you're ready. My patient walked 20 feet with no assistive device, good speed, no evidence for imbalance, and a normal gait pattern, which gives her a grade of 3. The second task is a change in gait speed. I'm going to give my patient the instructions. Begin walking at your normal pace. When I tell you go, walk as fast as you can. When I tell you slow, walk as slowly as you can. When you're ready. Go. Slow. My patient was able to smoothly change walking speed without loss of balance or gait deviation. She shows a significant difference in walking speeds between normal, fast, and slow speeds, which gives her a grade of 3.
Okay, so now we're going to be assessing gait with horizontal head turns. Now I'm going to instruct my patient. So I'm going to have you walk at your normal pace. I'm going to tell you right or left, and I want you to turn your head in that direction. I may also say look straight, and I want you to look straight when I say that. Throughout all of this, I want you to continue walking straight and at your normal pace. So begin whenever you would like. Right, left, straight. My patient was able to turn her head smoothly in both directions without changing gait speed, so I would give her a 3. Next, we're going to assess gait with vertical head turns. So now I'm going to instruct my patient. So I'm going to have you begin at your normal pace. When I tell you up or down, I want you to tilt your head in the respective direction and continue to walk straight. Okay? So begin whenever you're ready. Up, down, up, straight. My patient was able to turn her head smoothly, both up and down, without changing gait speed, so therefore I would give her a grade of 3. Next, we'll assess gait with pivot turns. So now I'll instruct my patient. I'm going to have you begin at your normal pace. When I tell you to turn and stop, I'm going to have you turn as quickly as you can, face the opposite direction, and stop. Okay? So begin whenever you're ready. Turn and stop. My patient was able to turn within 3 seconds and stop quickly without loss of balance. Therefore, I'll give her a grade of 3.
Alright, so the next task that we're going to assess is stepping over an obstacle. So now I'm going to instruct my patient. So I'm going to want you to begin walking at your normal speed, and when you come to the shoebox that's on the floor, I want you to step over it and not around it, and then keep walking. So you can begin whenever you want. So my patient was able to step over the box without changing gait speed and with no evidence of imbalance. Therefore, I'll give her a grade of 3, which is normal. So the next task that we're going to assess is stepping around obstacles. So I've placed the cones now 6 feet away from each other, and now I'm going to instruct my patient. So I want you to begin walking at your normal speed. When you come to the first cone, I'm going to have you walk to the right side of it. When you get to the next cone, I'm going to have you walk to the left side of it. And now you can begin whenever you want. My patient was able to walk around the cone safely without changing gait speed and no evidence of imbalance. Therefore, I'll give her a grade of 3, which is normal. The next task that we're going to assess is steps. So now I'm going to instruct my patient.
So what I want you to do is walk up these stairs as you would at home. You're only going to use the railing if necessary. So you're going to walk up to the top, you're going to turn around, and then you're going to walk back down. So you can begin whenever you're ready. My patient was able to walk up the steps with alternating feet and no use of the handrails. Therefore, I'll give her a grade of 3, which is normal.
This outcome measure is scored out of a total of 24 points. This particular patient received full points on every task performed, therefore she will receive a 24 out of 24. In the event that the individual scores less than 19 out of 24, this has been found to be predictive of falls in community dwelling elderly individuals. Thanks for watching.